Here's why 90% of today's exercises make knee arthritis worse. If you're doing exercises given to you by a healthcare professional or a fitness professional, anywhere in the health realm, for knee osteoarthritis, then I don't have a hard number. I put 90% here in the title of this video. I said that. But from my perspective, from what I see with patients that come in, from people that we're talking to online, more than 9 out of 10 of them, so it's probably more like 95%, more than 9 out of 10 of them are doing the wrong exercises that are supposed to be helping them with knee arthritis, but in the long term, they're getting worse. And what I mean are exercises like quad focused exercises, like knee extensions, quad sets, anything where you're having to focus on using the muscles in the front of your thigh. Squats done wrong. Squats can be good, but if you're doing them and using your thigh bones, your thigh muscles a lot, you feel like these muscles are working the most, it's done wrong. And there's sneaky ways that the squats happen, like sit-to-stands, where you're sitting in a chair and then you go to stand up. Every time you sit and stand, there's healthcare professionals that want to train you on this because maybe you kind of have a hard time standing and sitting. But if you're training using your quads a lot, then you're actually going to make your knee arthritis worse. And maybe you get better at standing and sitting in the short term, but in the long term, you're just deteriorating your joints more. Not helpful. What about walking? Everybody says you should walk more. It's good for your heart, good for your joints. But if you're using your quads all the time, you're using the wrong muscles, and walking is going to make you worse after a certain point. Cycling is the same thing. Whenever you're using the bike and you're pedaling with your feet, chances are you're getting your quads more strong. You see the theme that I'm talking about here? All these exercises are quad dominant exercises, and quads cause knee arthritis to get worse if you strengthen the quads. Hey, I want to tell you about our knee arthritis recovery program. This program is specifically for people that have knee arthritis, whether you've been formally diagnosed, you've had an x-ray or an MRI and the doctor told you that you have knee arthritis, or you suspect you have it. And it doesn't matter how severe it is, if you've had it just mild, grade 1, some doctors will tell you, or if it's more on the severe end. If you have tried exercises and advice and tips that I've given you through our videos here, then chances are you have benefited from it because this stuff works. Chances are even better that you're going to get tremendous improvements if you join this program. And let me just tell you how it is real quick, how the program's set up. It's a membership program, and there's different tiers of this. On the first tier, it's group coaching, along with the whole curriculum of 40 plus, I think it's approaching 50 videos now, showing you how to do it. So you can just go through the program, watch the videos, and have massive improvements, but you also get access to group coaching where I'm on the call with you, me and my coaches, and you get to ask us questions so that you don't get stuck through this program. And then you also have the option to get our higher tier, which is one-to-one coaching with our recovery coaches, but you still get the group coaching too, and of course you get the whole curriculum as part of that package. So go check out the link nearby here to learn more about the knee arthritis recovery program, and I hope to see you in the program on our coaching calls. What about recumbent cycling? Because there's upright cycling, where there's no backrest, like what would mimic an outdoor bike if you're using a stationary bike. There's also one with a backrest where the pedals are out in front of you. It's the same thing. And go try this out. If you do all these exercises or any of them, think back. When was the last time you got other muscles very tired besides your quads? Quads tend to get the most tired on these exercises. The elliptical machine, that one's real famous because it's a cross between walking and biking, and it's low impact on the joints. But are you using your quads all the time? Is that what gets most tired when you're 5, 10, 20 minutes in? If it's quad dominant for you, you bet you're making your knee arthritis worse. What about Tai Chi and yoga? There's research studies being done on this stuff, on its benefit with knee arthritis, and it's confusing. If you look at it, what is it about Tai Chi and yoga that is helpful for knee arthritis? Is there like some weird mystical power about it that's magically making our knee arthritis worse? I don't think so. I think it's how you're moving and how it causes you to move differently. But it might be making you worse if you're using your quads a lot. I think that's the mystical power behind this, is you are using the right muscles when you're improving and you're using the wrong muscles when you're getting worse. It's not the specific activity. It's not the cycling versus yoga or ellipticaling versus Tai Chi. It's how you're doing these activities, because they can all be helpful for you. You got to use other muscles besides your quads though. The glutes are what needs to be used. Then what about lunges? Maybe those are helpful if done a certain way, or maybe they're harmful. A lot of times lunges are bad for you because they tend to be a quad dominant exercise. Quads are the bad ones here. Practicing going up and down stairs, huge one, right? Especially if you have stairs at home, few stairs to get into your house, or you have a 2-level home and you have to go up and down stairs to get to the bedroom or the kitchen. You're going up and down stairs every day, but are you using your glutes or your quads? Because if you're using your glutes, it's going to take pressure off your knees. But if you're using your quads, it's going to add pressure to your knees. More pressure over time means you're making knee arthritis worse. Less pressure over time means you're helping your knee arthritis. So use your glutes. And then what about straight leg raises? This is an exercise very commonly given out to patients in physical therapy offices or from healthcare professionals who are in the fitness and health realm. Your leg is straight, you're lying down, and you're just picking your leg up and down like this. It's using your quads. It is making your knee arthritis worse whenever you use your quads more, because you're pulling that kneecap up against the thigh bone, and then you're pulling the shin bone up against your thigh bone as well. Anything that adds compression to the knee joint is going to make the knee joint worse over time. Just like calluses when you're lifting weights, calluses on your feet if you're barefoot all the time, that's your skin's response to increased pressure over time. Our body is designed to adapt to increased pressures over time. Muscles get bigger because you increase the load on them, the pressure through them, whenever you pick them up more frequently over time and with bigger weights. So is it no wonder when you look at the x-ray for your arthritic knee that you see thickening in the bone, wearing down to the cartilage? There's more pressure there. The bone's adapting by getting thicker because of the pressure. The cartilage is dying because it doesn't have a chance to recover because there's too much pressure on it. You need to depressurize your knee joint. And doing these exercises where they're quad dominant, which is more than 90% of the ones that are being given out there to patients with knee arthritis, they're making you worse. And healthcare professionals, I don't think they intend to do this. They're not trying to hurt you. It's just what they know. It's just what was passed down to them from people that didn't really know what they were doing before them. Our research studies out there are not up to date with what's best for knee arthritis. We're guessing. Most of the research out there is focused on surgery for knee arthritis. If you pull up knee arthritis treatments in any medical database, probably 9 out of 10 of them or more are going to be related to surgery, injections, medications, and a tiny fraction of them, 10% or less, is non-surgical, non-medicinal treatments. And if you dig in that area, which is the realm that I live in, they all contradict each other. This exercise hurts you sometimes, but this exercise helps you sometimes. This stretch is beneficial for you, but other times it makes you worse. Some patients got better, some patients got worse. We're in the Stone Age with all this stuff. But what I can tell you based on my treatment with patients, my personal experience, which it counts for what it counts for, I'm getting patients better by making them work their glutes out, by showing them stop using your quads. There's other muscles in the feet that you need to get stronger. The abdominals need to get stronger. What I ask of you is put it to the test. Try it out yourself. Make sure you can fire the right muscles. If you feel like you're confused about how you're doing this, get some help. We offer help. Go to our videos, watch our whole playlist, check out our knee arthritis recovery program. I do live calls with people on that program. You can ask for help and get this sorted out so that you can avoid a knee replacement surgery and get back to doing all the things that you love to do.